The city hums a smoky tune, a saxophone sighs to the moon.
So imagine a disease we once eliminated suddenly returning, not because we lack a vaccine, but because trust in that vaccine has weakened. So when some people don't say they don't take vaccine, I don't blame them. This is not distant threat, it is growing public health reality. Vaccine remain one of the most powerful tools in disease prevention. Yet debates around vaccine, policy, uptake, and public trust continue to shape whether immunization programs succeed or fail. I have had all my vaccines, and I will encourage you to do the same as well. But what you need to understand, vaccine policy is designed to protect the population, especially the most vulnerable. So decisions around vaccines, schedules, eligibility, and coverage are based on scientific evidence, surveillance data, and risk assessment. You heard me right. So the choice is yours. You're not under any form of you're not under any duress to have your vaccine, but it is very, very important you do have your vaccine. However, when policy change, such as introduction to a new vaccine or updates to recommendations, they can spark uncertainty and public concern. Yes, that's absolutely true. Without clear communication, this can cause confusion in the community. These changes may be misunderstood by some set of people or misinterpreted, or fueling doubt around the confidence in the vaccine. So now, the only way you can get around this is by keeping yourself up to date with the relevant policies and procedures. So uptake is where policy meets reality. So even the most effective vaccine cannot protect a community if people chose not to receive it. Absolutely. So that's why I said everybody has got the right and the choice to refuse their vaccine if they want to, or accept it. In recent years, declining vaccination rates in some regions have led to the re-emergences of preventable diseases such as measles and whooping cough. So this outbreak highlights a crucial truth. Why do I say that? I say that simply because immunization is not just an individual choice. It is a collective responsibility of the society. So for these medications to be out there for you to take as a vaccine to help you with your immune system, means it has been tested and trusted and safe to use. So at a center of this issue lies public trust. Trust is shaped by transparency, consistency, and credibility. So when people trust health authorities, healthcare providers, and scientific institutions, they are more likely to accept vaccines. So that is why making those information available to be as clear as possible to the populace that are going to be having this vaccine is very, very important. So when trust erodes due to misinformation, historical injustice, or lack of engagement, or lack of transparency in total, hesitation grows. Social media has amplified this challenge and allowing misinformation to spread faster than evidence-based guidance. So that is why when a new vaccine is coming in, it's very, very important for those around the vaccine creation and testing should bring out modern information and make sure the information gets to everybody to strengthen public confidence. Public health system must go beyond mandates and messages. They must listen to the communities, acknowledge concerns, and provide clear, honest information around benefits and risk. Healthcare professionals play a vital role as trusted messengers, while policies must be inclusive and sensitive to cultural, social, and historical concept. So like I said, this is my own research and this is my own perspective. You can do your own research and come up with your own perspective. But I would say, in summary, vaccines alone do not prevent outbreak. People do. So effective vaccine policy, high intake, and public trust must work together by prioritizing transparency, equality, and communication. Immunization programs can continue to save lives and protect community. The future of public health depends not only on scientific outbreaks or breakthrough, but on our shared commitment to trust, cooperation, and prevention. So that is why public health concern needs to be addressed as soon as possible, and any new update policy should be made available to the community. So that mutual trust is there, and more people are likely to take their vaccine, and our society will be kept safe. Thank you for listening. And if you're unsure about my channel is Chrissantus Investment, where we bring about latest updates about public health and sustainable living, like the energy, sustainable housing, property investment, and digital market. Kindly like, share, and subscribe to our channel, and I will see you in my next video. Thank you.